Hi, thank you for joining us today. My name is Natasha. I am a registered nurse and CEO of iCareRN, a care management company. I have been a nurse for over 20 years and used my nursing knowledge and experience to start my chronic care management business because I wanted to have more of an impact on the individuals I serve and also create a stream of income that would allow me to work for myself while still doing what I love. I work with doctors and nurse practitioners to provide care coordination services to eligible Medicare patients with two or more chronic health conditions. I help to educate patients on managing their chronic health conditions, improve their health outcomes and quality of life. I also offer a mentorship program that teaches nurses how to start their own chronic care management business. Today, I am joined by my fellow chronic care management nurse entrepreneur and geriatric nurse practitioner, Shamika. She will be talking about obesity and how care management services can help individuals with obesity manage their chronic health condition. Shamika, tell us a bit more about yourself and your background.
Good morning. So I am Shamika. I am a board certified adult and gerontology nurse practitioner. I've been a nurse for about 26 years, going on 27 years. I've been a nurse practitioner for the last 4 years, going on 5 years. Back in March 1st, 2021, I started my own chronic care own practice. And it is True Care Telehealth and House Calls practice. We are a chronic care management practice. We provide value-based care, including obesity management. I am a member of the Obesity Medicine Association, and I have about 30 credits to go before I become an obesity medicine specialist. So that's me.
Okay, so today we will be talking about obesity. Shamika, tell us, what is obesity?
Obesity is a chronic, progressive, debilitating disease that causes an overproduction of fat cells. These fat cells have the ability to hypertrophy or grow very, very large over time. People are not born with a fixed number of fat cells. People without obesity have about 25 to 35 billion fat cells, whereas a person that has obesity has between 100 to 150 billion fat cells.
All right, that's a lot.
Right. People with a BMI of 30 or over are considered obese.
Okay, so tell us a little bit more about what is the BMI and how relevant is it to obesity?
So the BMI, those are acronyms for body mass index.
Mhm.
And it's a tool that healthcare providers use to estimate the amount of body fat by using a person's height and weight measurements. It could help assist with risk factors for certain health conditions. And the BMI, we have to know this, the BMI is not always accurate. It's not always an accurate representation of a person's fat
Mhm.
percentage in their body.
Okay, all right. So why do you say obesity is a chronic disease, or would you say it's a chronic disease?
So obesity is a chronic disease. The American Medical Association in 2013 realized that obesity is not due to people being lazy and unmotivated.
Mhm.
After years of research and having patients to lose weight just to regain it all back and then gain even more at times, they collectively decided that it was a chronic disease with many relapses and it had to be treated as a chronic disease. So they gave it an ICD-9 code, which is 278.000, and it was officially classified as a chronic disease in 2013. About 40% of Americans are obese. That includes children. So that's 2 out of every 5 people in the room are going to be obese. And the condition lasts for 12 months or more.
Okay, so who is at greatest risk for getting obesity or becoming obese?
Studies have shown that genetics account for 40 to 70% of people with obesity. So the most prevalent contributing factor to becoming overweight or getting a diagnosis of obesity is a genetic disposition, meaning if your mother, father, sister, brother, aunt, uncle are obese, then 9 times out of 10, you will unknowingly acquire it.
Okay. All right. So is obesity curable?
This is the sad part. No.
No.
It's not curable, it's manageable. You have to work at it daily to keep those fat cells under control because they're looking to grow and grow and grow, right? Excessive body fat is caused by genetic developmental errors, infections, hypothalamic injury, adverse reactions to medications, nutritional/energy imbalances, and unfavorable environmental factors. Once you're diagnosed with obesity, you will always be at risk for obesity.
So how does a chronic care management program integrate obesity management?
So when we talk about chronic care management and the value-based programs, we generally look at the 65 and older population. However, Medicaid also pays for a medical weight loss program. Medicare and Medicaid has termed the program behavioral modification because we know for you to make any changes in your life, then you have to modify your thought process, right? It takes some brain work. So the program that they offer has 4 core elements, and they use the Obesity Medicine Association 4 pillars of obesity management, which are behavioral modification, that's the counseling, the nutritional support, a physical activity commitment, and pharmacology. Medicare and Medicaid require that your initial program lasts for at least 6 months, which is about 21 visits. And then by the end of the 6-month period, the patient has to have lost at least 5% of their body weight. If they haven't lost that 5% of their body weight, the provider has a responsibility to counsel the patient and see what's going on, you know, what can we do about this? And if the patient is just not ready, then they're discharged from the program. If there's things that could be modified, then the provider has to write a letter to Medicaid or Medicare justifying the patient not losing the weight, and the Medicare or Medicaid, the insurance will possibly give you another 6 months. Within that next 6 months, which equals 12 months, if you still don't lose the 5%, you're automatically discharged.
Okay.
Yeah.
You have to, follow the program. So remote patient monitoring is part of your obesity management program, or how does remote patient monitoring help with someone who is on an obesity management program or enrolled in a program like that?
The remote patient monitoring part would, of course, we would use a scale, give the patient a scale, and we're monitoring their weight on it could be a daily basis, but because a lot of times stepping on a scale messes with a person's mind, I like to say step on it once a week as opposed to every day. Another way would be the Apple Watch through apps like the Apple Watch or MyFitnessPal. You're monitoring the patient's movement with the Apple Watch. With the MyFitnessPal, you're monitoring their diet on a daily basis, and they take that. Medicare gives a stipend, not Medicaid, Medicare gives a stipend for an Apple Watch. It's $150. You could get a first generation Apple Watch with the $150, or a gently used Apple Watch possibly with the $150, but it's $150 more than what you have to get that Apple Watch, so we can monitor you from afar.
Okay, so with that stipend that they're giving, right? How do they get that? Do they get it through your program? When they're in your program, then they can apply for it? Is that how that works, kind of?
Yes.
Okay.
So initially when they enroll in the program, then we have to send Medicare all of our documentation to
Right.
justify the payment. And one of the things that we add in there is the need for the Apple Watch for remote patient monitoring, the
Okay.
need for the scale for remote patient monitoring.
Okay.
Yeah.
So let's talk a bit about obesity related lab work. What type of lab work do you perform for someone who is now enrolling in your obesity management program or for someone who is diagnosed with obesity?
The labs are used for two parts. The first part is to make sure that the obesity is not caused by some other underlying condition, PCOS, polycystic ovarian syndrome, or other things, medications. Your cortisol levels are off, hormone levels are off. And then the other part is to make sure that you don't have any underlying conditions as a result of the obesity. So you would get a CMP, comprehensive metabolic panel, a CBC, complete blood count, fasting insulin, cortisol, estradiol, which is estrogen, follicle stimulating hormone, testosterone, DHEA, which is a hormone that all of our bodies produce, but when you're obese or overweight, sometimes when you draw the lab, the DHEA is low, and then you supplement, you replace it. Iron studies, C-reactive protein to make sure that there's no inflammation in the blood vessels, lipid panel to check your good cholesterol, bad cholesterol, triglycerides, and then liver panel, LFT, or liver panel, to make sure your liver is doing what it's supposed to do. Vitamin D also.
Okay.
Yeah.
All right. So what are the top diseases that may accompany a BMI over 30?
The top three are diabetes, hypertension, and high cholesterol. However, if it was me, I would also add pain, because I haven't met an obese person or a person that is suffering with obesity that doesn't complain of pain. Back pain, hip pain, knee pain. So I would include pain, but the top three are diabetes, hypertension, and high cholesterol.
Okay. So also tell us a bit more about your obesity management program and how it works, just generally how that obesity management program would work. Say I'm a patient coming in with, obesity, and, you want to enroll me into your program. How do we kind of get started with that program?
So do you have insurance or not?
I do have insurance.
You do have insurance. So if you have insurance, then your program would be a 6-month program based on the requirements by Medicare and Medi-Cal. And it would include the 4 pillars, which is nutritional support, which is the second pillar, but behavioral modification, talking to you to see what do you think caused this? What do you want to gain? What are your goals? The second pillar is nutritional support. There's so many diets out there. All diets work. All diets fail, right?
Yes.
The third is the physical activity commitment. You're not getting results if you don't move, because you're not building muscle, right? And muscle burns fat. So the third is physical activity commitment. And then the fourth is pharmacology. We almost always need some type of assistance. There are those very unique people that are excellent, and I give them 2 thumbs up, that could just go head on and get it off, and that's it. But then there's the rest of us in the population that's just not our reality. So a pharmacology, some type of medication, and right now what's winning in the race of pharmacodynamics for obesity is the semaglutides. And the semaglutides are the Ozempic, the Wegovy, and the Mounjaro. You can lose at least 15% of your body weight within 12 weeks to 6 months taking this medication, which is a once-a-week injection.
Okay.
Yeah. Well, I just want to add this, Natasha. I started the program November 5th again, because over the time I regained weight that I had lost. And I started November 5th, and from November 5th to yesterday, I weighed myself. I'm down 22 pounds. So it's very effective. Yeah.
Okay, great. Good. I would love to get enrolled in that, Shamika.
Yeah.
All right. So thank you so much for your time today, Shamika, and for sharing this valuable information with us. If you would like to learn more about Shamika's services, you can visit her website, truecaretelehealth.com. I will include the link in the description below. And if you are a nurse and would like to learn more about my chronic care management mentorship program, just to help you start your own chronic care management business, I will also include that information in the description below. So thank you so much, Shamika, for your time. Have a great day, and we'll talk again soon.
You too. Bye.